So just to recap, CGM, we know and we have ample of data that shows that continuous glucose monitoring work, that it improves glycemic control, A1C, as well as it decreases the risk of hypoglycemia. But most of these studies are done in a research setting, and so what we wanted to see was that in real life, in a clinical setting, people who are actually using CGM versus people who are doing their monitoring via glucose monitor, what are the differences, especially as far as the glucose control and risk of hypoglycemia. So we took adults, the 15 of them who were on continuous glucose monitoring, they were using that, and the other 18 who were using the regular glucose monitor. And we saw that people who were using continuous glucose monitoring in a real world setting did have actually improved glycemic control. Their A1C was lower than the people who were using the glucose monitoring, and they had actually lower risk of hypoglycemia, whether you consider nocturnal hypoglycemia or overall hypoglycememia. However, we saw that the people who are using the CGM, they were more worried about their hypoglycemia, and they tended to have more hypoglycemic unawareness. So even with hypoglycemic unawareness, even with worrying about their hypoglycemia, population using CGM did have better control and less risk of hypoglycemia. That was our sort of finding in a nutshell. Well, actually, having the CGM have really helped us understand what we were missing, right? So we were really focusing on hemoglobin A1C as a target for glycemic control, and even though we knew that hemoglobin A1C is a mean glucose and it does not reflect the excursion of glucose levels throughout the day, I don't think we realized how much of that was going on. And having a continuous glucose monitoring have shown us that whether people have high glucose, high A1C or low A1C, we really are not able to tell how much time they are spending in highs and how much time they are spending in low. With the technology of CGM, we are now understanding that it's what they spend, what is called time in range, that is important, because we want to avoid both highs and lows. So then the question is that how much of that technology is usable, and with the newer and newer CGMs coming out, I think it's less and less the technology wise, it's easier for the patients to use. Hopefully, as the cost becomes a little less prohibitive, I think continuous glucose monitoring will become the primary source of monitoring glucose level in majority of the patient. But currently, people who are on insulin who have high risk of excursion, certainly the CGM should be used, and it certainly has a significant benefit in both controlling the glucose level as well as preventing hypoglycemia, which is a safety issue. My particular area of interest is type 1 diabetes in aging population, and so I'm sort of going to tell you about that because there is a lot going on that area, but the good news is that with all these different advances in diabetes, people are living longer, and patients with type 1 diabetes are living longer. The bad news is that we know next to nothing about how to manage this population any differently than younger population. So what we are looking at is that how is this patients with type 1 diabetes who are now aging are different, and what should be a specific strategy or specific ways of looking at them. And we are doing studies on that population, and what we have found is that compared to type 1 younger adults, that people with type 1 diabetes who are getting older, they have similar risk of hypoglycemia and all the things that come with that, but now they are also having age-related issues that is added to that, the other medical comorbidities, worry about things that are not necessarily typically related to type 1. So I think now recently Medicare has started paying for the CGM, real-time CGM in this older population, so that's exciting. We are using more technology in taking care of aging population with type 1, who, unlike the previous older adults, they are used to using technology, they are savvy, and they can now do that along with this aging process. So that's a new thing that I think we are sort of seeing, that use of technology across the spectrum in improving not only diabetes management but improving safety with CGM.